Hello friends, in this video we will see about what is a ventilator, what are the functions of a ventilator, and what should we understand when we come across someone saying that a patient is being put on a ventilator. So ventilators, the term ventilation is not a new term for us, right? So we would say like whether the house is well ventilated or not. What does we actually mean when a house is being well ventilated house? It means the house has adequate doors and windows so that the air inside the house is getting exchanged, because the air inside the house is being continuously utilized by the humans and carbon dioxide is being produced. So in outside air there is so much of amount of oxygen which will enter the house only when it is well ventilated. In the similar way, the same process happens within our body as well. In our body, so much amount of carbon dioxide is being produced and there is oxygen in the external atmosphere. So the process by which the oxygen in the external atmosphere is being utilized by the body and the carbon dioxide which is produced in the body is being exhaled out into the external atmosphere is what we can roughly equate to ventilation. So how does this ventilation happen in our body? It happens through our lungs. This lungs contacts with the external atmosphere through some pathway which we call it as airway. The way for the air to pass the lungs, to reach the lungs, is what we call it as airway. So how it is significant? Because it's not a big deal. There is a ventilator here which works, which functions, and there is a patient's lungs which is being damaged. But establishing this connection between the patient's lungs and the ventilator by itself is an art. So which is usually done by the anesthetist. So Andreas Vesalius in 1543, he passed a reed into the trachea of an animal. Then he was able to ventilate the animal and he saved that animal. That's how it became so popular. Even for humans also, we have the same kind of tube. This is nothing but a tubular structure. You can see, right? This tube is also made of plastic, which is PVC. That's all. This goes into the trachea of the patient, through which we will be able to connect the ventilator and ventilate the patient. So, but securing this tube is not that easy task. By this itself needs so much of skill, through which we secure this tube through a process called laryngoscopy, for which we use a device like this, which is being inserted into the mouth. By this process itself has so much amount of side effects. So to overcome that, they came across with some other thing called supraglottic airway device. This doesn't go into the trachea. This just sits above the vocal cord. This we can directly connect it to the ventilator and this will go into the mouth of the patient like this and it will ventilate the patients. So the significance of this is this airway device itself is a $1 billion market which is worth about like $2.2 billion and which has a growth rate of about 8%. So this ventilator itself is not that big market because this is a single use device for each and every patient. We use it multiple times. So this is so much amount and this requires so much amount of skill for which we have to read so much amount of things. So even when I proposed for a new airway device at IIT Gandhinagar, the panelist asked me, is there an ENT surgeon or a pulmonologist in your team? I said, airway is an expertise of an anesthetist. Usually, any of the department people, if they experience any difficulty in managing the airway, they usually call the anesthetist, because whenever we take the patient under anesthesia, we have to secure their airway and we have to usually put the patient on the ventilator. So that's why even during COVID time, so anesthetists were given so much significance. So this is actually not a ventilator exactly. This is a ventilator, but this as a whole setup is what we call it as anesthesia workstation. This itself is a monitor which I have showed off as of now. These are like vaporizers and it has so many other components. Right now we will just see what the functions of the ventilator. So one thing we will see about the few things in this ventilator. What we are seeing here is the FiO2, which means fraction of the inspired oxygen. Usually in the atmosphere, the oxygen is about 21%. So here also we can keep it 21%. We can gradually increase it to the desired level we want till 100%. So the second thing is like we have something called the tidal volume. When we take a breath like this, the amount of air that goes in and comes out is what we call it as tidal volume, the volume of air which goes in and out. So here I have set it as 520 ml. So that's what it is expanding inside this bag. So this is what we usually call it as the test lung. Before putting the patient on the ventilator, we usually test this ventilator whether it is working properly or not with the help of the lungs, because with the help of the test lungs, because once we connect it to the patient, we will never know whether there is some dysfunction in the ventilator or the problem is because of some dysfunction in the patient's lungs. So on the next thing is the respiratory rate. So many alarms, even you would have noticed, so many alarms are coming while I am demonstrating this, because these are usually called as the safety alarms. This anesthesia machine has so many safety features, so that when the patient gets disconnected or when the patient is not getting ventilated or there is some problem, it will give some alarm so that you can make some action to correct it. So this is the thing. So the next thing is respiratory rate, which is the number of breaths which we usually take whether we are awake or whether we are under anesthesia. So this is something called as peak. So for example, if we keep the peak as 0, you would see this test lung collapses more before even expanding. Sorry, now that I don't need to do that. So you can see the test lung collapses more before expanding. But if you keep the peak at some level, for example, if you keep it 9, you would see the lungs is not completely collapsed. It is remaining open. In the similar way, we don't want the human lung to completely collapse and open again every time, because it will cause so much amount of trauma, which is called as electrotrauma. To prevent that, we usually have this trick. So apart from that, there are many other modes. This is what we call it as volume control mode, where we control the amount of volume which is going during each breath. So there are other modes called pressure control ventilation, pressure support ventilation. In pressure support ventilation, when the patient breathes, just some support is given to take the breath adequate. So other thing is manual ventilation, which means the patient is not spontaneous. Whatever the patient's breath is, like it will be there only, or else you have to manually ventilate the patient. So only if I ventilate the patient, you will be able to see some changes in the patient lungs, else nothing won't happen. So why there are so many modes in anesthesia ventilation? Because in an OT, a patient comes breathing. So we need some ventilation for that. After that, when the patient is given anesthesia, after the patient is given muscle relaxation, he stops breathing. So we need to support his breath, for which we use volume control mode commonly. After that, the patient starts, at the end of anesthesia, the patient starts breathing. Initially his breathing won't be adequate. Gradually he will start breathing. So that time we don't want the patient to be completely controlling his breath. We just want to support his breath. So that's why there is a pressure support ventilation mode. So these are the usual ventilator modes which we have. So right now I will just explain you what does it exactly mean when a patient is on ventilator. So when a patient is on ventilator, it means some function of the lung is not being done properly. That's why we support the function of the lungs with the help of this ventilator. So when we have an injury, what the doctor usually does, he usually does a dressing over. So does the dressing exactly heal the wound? Not really. The dressing only provides the environment for the wound to get healed, but the actual healing is done by the body. In the similar way, when 100% of your lungs is working with 21% of oxygen in the atmosphere, you are able to maintain a saturation. For example, if your 50% of your lungs is not working, the same amount of oxygen in the atmosphere, you won't be able to maintain the saturation. So that's why we have the option to increase the amount of oxygen. In the similar way, when you are tired, you would have seen in COVID patient will be breathing very fast, like this. So if they breathe like this, they will become very tired so fast. So that's why we have few functions of the lungs which is taken out. But actually, this doesn't replace the complete function of the lung. This gives the lungs to time to it does the function of the lungs for some time, so that the lungs will recover after some time. So if you give adequate time, the 50% of lungs which has been damaged, it will automatically start recovering. So that's why we support its function with ventilator. So usually, whenever a patient is on ventilator, he is always kept on ICU, which means the patient is critical, because when his lungs is damaged, it is always a critical condition. So does that mean whether the patient is how much is the patient survival? If you ask me, it depends on the individual patient's condition, his age, whatever the disease he is suffering from, how you are treated. It is based on multiple factors. We cannot exactly say if a patient is on ventilator, he is in a serious condition. It depends on that. condition of the patient. For example, usually in anesthesia also, sometimes at the end of surgery we don't extubate the patient, we keep the patient intubated with ventilator and send the patient to ICU, but usually those patients get extubated fast. But if the lung is like so much damaged, then actually it depends on that. So we can in general understand that when a patient is on ventilator, we can understand that his lungs is not working properly and he is in a critical condition, and rest of the things has to be discussed with the doctor. So I hope that I have explained you what is a ventilator in a simple way as far as possible. If you have any other doubts, kindly leave it in comments. I will try to explain that. Apart from that, if you wish to know any other topics, any other further topics regarding all these things, you can leave it in comments. I will make a video on that. So I will see you in one another useful video like this. Until then, it's Aravind signing off. Bye.